My name is Sarah Tischer, and I'm a clinical pharmacist with expertise in solid organ transplant at the University of Michigan.
If you are on an organ transplant list, you may be able to receive an organ sooner if you agree to receive one from a donor who tested positive for hepatitis C, also called HCV. We know that there is a lot to consider with this decision, so we wanted to share answers to the questions that our patients frequently ask us. Watch this video after you have already learned about accepting an organ from an HCV positive donor. Here is the first question. If I get HCV, could the virus damage my transplanted organ or any other organs? The answer is, very rarely, severe acute HCV infection can cause liver, kidney, or other organ damage. The risk is less than 1%, or less than 1 in 100 people. Once we treat and cure the HCV, your transplanted organ or liver will not be affected by it anymore. Here is another question we get often. Can I transmit HCV to other people? Answer. While you have an active HCV infection, you can transmit HCV to another person through blood interaction and rarely through sex. HCV is not passed from person to person through casual contact like hugging or shaking hands or sharing things like glasses, utensils, or towels. Once you are cured of HCV, after taking the antiviral medication, there is no risk of transmission to another person. While you are HCV positive, you will need to follow these precautions in order to prevent infecting others. Do not share toothbrushes or razors with others. If your blood gets on a surface, use bleach to clean it up. Use a latex condom when having sex. Question. Will the antiviral medications cause problems with other medications after transplantation? Answer. The antiviral medications are safe to take with your anti-rejection medications. We will review all of your medications at the time you are called in to receive a HCV positive donor organ, and the transplant pharmacist will work with your doctor to identify and manage any drug interactions. Question. Do the antiviral medicines work as well in patients who get HCV from a transplanted organ as they do in patients who get HCV from other causes? Answer. Yes, we expect antiviral medicines to work just as well in treating people who were infected with HCV from a transplanted organ. To date, nearly 99 out of 100 patients, that is 99% of patients, who received an infected donor organ and took antiviral medicines were cured at 1 year post-transplantation. More research is needed to have a definitive answer. Question. Am I at risk of getting other infections if I choose to receive an organ from a donor who is HCV positive? Answer. Due to shared risk factors, HCV positive donors are at a greater risk of having hepatitis B or HIV infection. To minimize this risk, we only use organs from donors who tested negative for both HIV and hepatitis B infection. The likelihood of these viruses not being detected during organ donor screening is less than 1 in 100,000. All transplant recipients undergo testing for hepatitis B and HIV infection at 4 to 8 weeks after transplantation. Question. What if I am not cured of HCV with the antiviral medicine I received? Answer. Although we expect the initial antiviral medication will likely cure you of HCV, there is a small possibility that the treatment will not cure you of the infection. In those instances, we will do additional testing and propose an alternative HCV antiviral treatment. Question. What if I lose my prescription coverage or my insurer won't pay for the cost of my HCV antiviral medication? Answer. Our financial coordinator will check your insurance benefits before we agree to place you on the list to receive an organ from an HCV positive donor. If your insurer no longer provides prescription coverage for Mavyret or Epclusa after transplant, we will work with your insurance and patient assistance programs to help you get coverage. If you lose your insurance coverage after the transplant, we will help you with other resources to make sure you complete your HCV antiviral medication course. Question. What if I have to go to the local hospital after I'm discharged from Michigan Medicine? Answer: always tell any care provider that you are a transplant recipient. Make sure you tell them that you received a HCV positive donor organ. Also let them know you are taking antiviral medications and cannot miss a dose. Always bring your medications with you, including your HCV antiviral medication. Thank you for watching this video. We hope it answered your questions about receiving an organ from an HCV positive donor. If you have more questions, please call University of Michigan Transplant Center at 1-800-333-9013.